Okay. Hey Denise, how are you?
Good. Nice to see you.
Good to see you. Hey, when I was here last and downloading your data, I noticed a couple things, and I also had a chance to talk to some of the staff. So, when you guys use the Arctic Sun, you guys do a great job of pulling it for cardiac arrest, but do you guys ever use it for refractory or neurogenic fevers that are uncontrolled?
You know what? I don't think we have. Not to my knowledge.
Do you think the physicians ever think of it?
Probably not. I think really we look at it. It's for our cardiac population.
Okay. See, I think that's what I'm seeing in a lot of my hospitals is that because we use the Arctic Sun so often just for cardiac arrest, I think everyone forgets that this is a temperature management system that you guys can use for any situation between 32 and 38.5 degrees. So whether it's cardiac arrest, whether it's maybe a drug overdose, a noxic event, those are the kinds of situations you guys want to consider using it for. So I guess I should start off by saying, what do you guys recognize as fever? At what level?
Typically, we're treating if a patient's temperature rises above about 100.3, 100.4.
Okay.
There's almost always an order for Tylenol.
Okay. And so you guys start with Tylenol. That's pretty routine. And how long would you keep the patient on Tylenol for?
Well, the medication orders usually read Q4, but certainly, if that patient is not responding at all, nurse will typically go and get ice packs.
Okay, so ice packs, water blankets, probably another 2 to 4 hours.
Yeah, if the ice packs aren't working, that's probably our next line of defense against fever would be the water blankets.
Okay, well, you know what? Just want to let you know, you're not different than any other of my other hospitals. They're all doing the same thing. But I will tell you, they are starting to entertain the other option because they have the Arctic Sun, just as you do. And I think we need to remember that you have this advanced temperature management system right there at your disposal. So for those uncontrolled neurogenic fevers, those refractory fevers that you've just tried everything and it's not working, if their patient's not responding, you guys need to know that you can pull the Arctic Sun just for that very purpose. So here's a tool that we are using now just to help staff understand what's going on. And so basically what you just shared with me is very typical in a lot of hospital situations. But people are now starting to be much more aggressive and proactive. So I think we can agree that everyone likes to maintain and have control at 37 degrees, right? So what you just described is that you go ahead and order Tylenol. And if the patient's temperature is still oscillating and you still have uncontrolled temperatures, then you progress to the water blankets and ice packs. It gets messy, gets more complicated, the patient's temperatures are still vacillating. So at this point, I think everyone is now agreeing that uncontrolled patient temperature is not beneficial in any way. So what we're doing is reminding people, you've got the Arctic Sun, remember to pull the Arctic Sun just for that purpose. That's at least the one vital that you can control out of all the things that you have between the heart rate, the blood pressure, the ICP. If you can control and stabilize temperature, imagine the domino effect it might have on those other variables. So what I'm offering to everybody right now is the opportunity to do the Arctic Circle with a focus in neuro. And that will help create more awareness and also reinforce the fact that you guys have advanced temperature management. And it might be something you guys want to incorporate into your protocol. Is that something you might be interested in having?
Absolutely. Definitely would be open to have more conversations and get one of our some of the physicians involved.
Okay. I would even be happy to even consider bringing in us, because I know you only have 2 units, and I know you want to reserve them for cardiac arrest, but if it makes sense, because you guys have such a huge patient population, what we can look at doing is maybe bringing in an evaluation unit, just strictly for neuro, so you guys can actually see the data and how well it may work for you guys.
Sounds good. That sounds like an excellent idea.
Well, let's talk next on that.
All right. Thanks, Chris.